Conversation brought to you by Marcus and Mack, a law firm representing injured people. Michael Foote, you have somebody with you as well.
I do. I have Roland Francis, who is our pre-treatment coordinator, and the gentleman who's kind of spearheading this COVID surveillance that we're doing at the wastewater treatment plant.
All right. So we've been talking about this through the course of the morning, and the Indiana Borough puts this report up every week, the weekly test, and we'll talk about the latest trending on that. But Newsha, let's talk with you first. Newsha Ghaeli, your company is called Biobot, yes?
Yes.
All right. So Biobot has this amazing technology that is being used here in Indiana Borough. Tell me about it.
Yeah, so Biobot Analytics is a wastewater epidemiology company, and what that means is, we look at sewage as being a collective urine and stool sample, or a community urine and stool sample. Mm-hmm. So in the way that you can tell a lot about a person by analyzing their poop or their pee, we can do the same by analyzing sewage at the community level and get aggregated data on the overall health of a community. And over the last several months, we've applied this technology to measuring the presence of COVID-19 in communities, because you are shedding that virus in stool every time you use the bathroom. And so we are tapping into wastewater in order to understand trends of COVID-19 in communities over time.
And obviously, we think about that in terms of COVID-19, but you've been doing this for a while with other health trends as well, right?
Yep, absolutely. We started a couple years ago by focusing on what was the biggest public health crisis up until COVID-19, the opioid epidemic. Mm-hmm. And we were looking at different types of opioid, both prescription and illicit opioids that were being consumed and excreted in urine, in this case, mm-hmm. in order to help public health departments tailor programming that was, more effective given the context of a specific community.
Roland Francis, Michael Foote, let's talk about how Indiana became involved with Biobot and with specifically the COVID-19 protocols that you're going through right now.
Sure. Well, I want to say it was probably back in March. I received an email from a colleague, if you will, a professor over at IUP, suggesting that I take a look at the work that Biobot was doing, which I did. I was intrigued and sent the information to Roland and our other staff over at the wastewater plant. And we collectively agreed that this was something we thought was really important for us to do. Plus, we thought it would be great to be able to take advantage of the initial offer that Biobot had made to wastewater plants participating in the early stage of this work. And so I want to say maybe about mid-April is when we started collecting samples and sending those in. And we felt that it was helpful to be tracking that data as early as possible so that when the students did ultimately return, we'd have some sort of baseline trend already established to be able to compare against once the students did return.
Roland Francis, tell me about what your reaction was when you learned that this technology was available. Had you tracked this sort of activity before? Were you aware of it before?
I was not. This is a very new technology to the at least to a typical wastewater plant. There's highly sophisticated processing, to be able to analyze the DNA. That kind of equipment isn't around in typical wastewater treatment plants.
No.
It's required by the regulators to do any kind of testing for DNA or by the state.
Yeah. Newsha Ghaeli is with Biobot. Newsha, your involvement with Indiana now, as opposed to other communities around the area. Do you find university towns are seeing increases in COVID-19 through this testing?
We have seen that in some places. We have seen some university towns over the last month, depending on when they saw their population return, see increases. We also saw something similar with more, I'd say, like summer vacation places back in May. So around Memorial Day or after Memorial Day, we started to see some increases in places that actually see a large influx of tourism in the summer months. So anywhere where we've seen a large change or a shift in population, it hasn't been out of the ordinary for us to see an increase in the virus concentration.
I would guess the state is very interested in your work as well.
Yes, in a handful of places across the country, we are working directly with the state level agencies. So Biobot over the last several months has worked with hundreds of communities, almost 400 communities across the U.S. In over 40 states we've worked with. In some cases, we're working directly with a state agency. In most cases, we're working with cities and counties. And I'd say in the majority of the communities that we're working with, the data is being shared amongst agencies. So cities to counties, counties to states, which is great. Seeing that inter-government agency collaboration on this issue has been really great to see.
Must really be a tremendous benefit for all of these people to get that data and to crunch it up and find out what comes out on the other end of it. Michael Foote, let's talk about Indiana Borough's latest report because it shows, again, another increase, and that's been a trend, hasn't it?
It has been. We've seen at least the last couple of weeks now some increases in the concentration of COVID. And so it makes sense that as we've seen increases of reported cases on campus, in the community, that we would see those numbers increase. And again, please remember that the information we're getting, and Newsha can say far more than I can, but it's the information we're receiving is predictive, so it's giving us a snapshot in time that's predictive of several days plus into the future. And so when we were starting to see increases, we alerted our partners, and then we started to see those increases of cases being reported.
That being the case, what can Indiana Borough do other than publishing this very informative report about the trends? But does it help to inform policy?
Well, I think policy is one piece. We also feel that reaching the community, and that's why we put together the messaging campaign Together Indiana, was to continue to remind our community to be safe, to take measures, to take actions that can keep themselves safe. And those basic things that we hear over and over again about wearing a mask, social distancing, washing your hands, paying attention, those things are really critically important for us.
Yeah. Roland, I want to ask you as well, with this being the case, I'm sure that you're taking extra precautions at the plant itself.
Yes, we are. Wastewater has, many infectious properties, so, we're well prepared to handle infectious waste, and, we have the proper PPE down at the wastewater treatment plant.
Yeah.
And in addition to that, we're also, taking temperatures of the employees and anyone who would enter the wastewater treatment plant. We're keeping social distancing. We're staggering break times. We're doing what we can.
Doing everything you possibly can. Keep your own folks safe, and then in the meantime coming up with some really, really interesting and, it could be groundbreaking information for Indiana Borough in where we go forward from here.
And also, Todd, our employees are coming to work every day, and we have to do all that we can to keep them safe and healthy. So we have established protocols and procedures to keep them safe. And if something occurs, we've done our pre-planning so that we can be able to respond effectively to whatever we might encounter.
Yeah. Well, I saw the report the other day, and I said, I have to get Michael on the air with us. And, Michael, you arranged for Newsha to come on the air with us. Newsha, what's next is an easy question to say, but there's not an easy answer, is there?
Yeah, what's great about wastewater and wastewater epidemiology is that we don't need to choose between public health priorities. That same sample that comes back to our lab can be tested for a whole variety of infectious diseases. We can look at things like nutrition, like diet. So we are actually at the moment working on moving into influenza testing, especially coming into influenza season. Mm-hmm. So that's currently in R&D at the lab, and we would love to be able to start offering that soon. But I also want to add that while we bring the technology and the science, like this work would not be possible without forward-thinking community leaders like Michael and like Roland. And so, we need to really be all working together in order to bring this technology and bring this science into our communities to really make an impact. We can't actually make that community impact without partners like we have in Indiana Borough.
Newsha Ghaeli, Roland Francis, Michael Foote, thank you all for being with us today. I appreciate it.
Thank you very much.
Thank you.
Y'all have a great day.
You as well.
Day.
You as well.